Hello, welcome to this month's summary board update, which took place at Endeavour House in Ipswich on Tuesday the 15th of July. The meeting started with the Chief Executive's update from Ed. He started by congratulating Nick Hume, who was made a Commander of the British Empire for services to the NHS.
Firstly, huge congratulations to Nick on your CBE. Fantastic, a considerable achievement that reflects the work you've done nationally and locally over many years. So we're all really proud of you, Nick. It's fantastic. Congratulations.
Ed told board members that the ICB has started a formal consultation on the proposed leadership of the proposed new Suffolk and North East Essex ICB. He said it reflects the national drive to cut running costs and to strengthen commissioning for our communities. The consultation, which began on the 9th of July, will run until the 8th of August. A new service that will trial health checks for people aged 30 to 39 in Clacton to improve early identification of cardiovascular disease has been launched. The Early Age Health Check pilot aims to encourage those people to have an NHS assessment to determine if they are at high risk of getting illnesses such as strokes, heart disease and diabetes. Health checks are usually carried out for people aged 40 or over. Patient satisfaction with GP practices, NHS dental and pharmacy services across SNE has gone up this year. Figures from the 2025 Ipsos Mori survey show 78% of patients expressed overall satisfaction with their GP practice, higher than the national average of 75%. Almost 90% of patients said they were satisfied with local pharmacy services. These results are based on the responses from over 10,500 patients in SNE. The final item in the Chief Executive's update related to the annual Suffolk and North East Essex ICS Can Do Health and Care Awards, which took place earlier this month. The event celebrated excellence from the NHS, social, voluntary, faith and community groups. It took place at Newmarket Racecourse on the 4th of July and was attended by more than 350 staff and volunteers from across the patch. For pictures, please have a look on the ICS website. The board was then given an overview of the Sustainability Review, which sets out how the system could best deliver quality and affordable health services to communities across Suffolk and North East Essex in the future. Here's the Deputy Chief Executive, Richard Watson.
We started the review with three interlocking questions. So the first was effectively, how do we make a reality of that shift left? So how do we put more capacity, more time, more energy into our community and primary care based services to improve outcomes for our population? The second question related to effectively the sustainability of our two big providers, so ESNEFT and West Suffolk within that context as our acute and community trusts. And the third question was kind of what practical things could we actually start to put into place to ensure that those two organisations and the wider system are sustainable in the longer term.
Richard then outlined some of the challenges that the review is looking to address.
One of the major challenges is our ageing population, the growth and the ageing demographic, particularly within the Suffolk context. But also allied to that, even though we've got overall health outcomes are positive, at or above the national average, we have significant inequalities within our communities. And some of the findings which we've seen previously were quite stark in terms of differential mortality outcomes for elements of our population within Suffolk and North East Essex.
The board was then given an update on the NHS 10-year plan. The blueprint sets out a bold, ambitious and necessary new course for the NHS. Through the three shifts, from hospital to community, from analogue to digital and from treatment to prevention, the plan aims to personalise care, give more power to patients and ensure that the best of the NHS is available to all. Here's the Director of Ipswich and East Suffolk Alliance, Maddie Baker-Woods.
I think that the proposals for neighbourhood health are so aligned to the work that we've been doing, and that we know that at the heart of the neighbourhood health teams are the statutory providers, our community services, our social care services, our GPs, but also that wider network of voluntary organisations and community representatives. And I think that that provides very firm and clear way for us to ensure that that connection with our communities is continued from us. So I really wanted to say that. I think the plan speaks to that as well in terms of the focus on prevention and the focus on neighbourhoods.
Ed Garrett said he welcomed the greater emphasis that the plan places on digital.
One of the headlines of the plan is the use of the NHS app. and I think our uptake is in line with the national average, but it's about 5%. So I guess the question for us is, how are we going to up it? Yeah.
Now, the chief executives of Healthwatch Suffolk and Essex gave a statement to the board about the future of the organisations. It was read out by the CEO of Healthwatch Suffolk, Andy Yakoup.
Please be assured that at Healthwatch Essex and Suffolk, we are operating business as usual. We are continuing to deliver our work championing the public's voice, including all previously agreed upon work. We are also still available for new commission projects. We appreciate your support at this uncertain time and have been overwhelmed by the kind words and support from stakeholders such as yourselves. Although we are supporting the national network of local Healthwatch organisations to question the decisions made, we are also looking at how we can continue to ensure lived experience and user voice remain at the heart of all decision making in Essex and beyond. We can only do this with the continued support from our partners across health and social care. Our common values and combined Healthwatch offers to SNE, Suffolk and North East Essex, over all the years the system has functioned as a leader amongst its peers, will be extended to whatever the new ICBs will be across Essex and Suffolk in the future.
Moya McGrath is Director of Commissioning Adult Social Care for Essex County Council. She said Healthwatch has provided strong value to the work of the local authority.
One of the things that's been really positive about Healthwatch historically is the critical friend role that they've taken. So whilst in kind of modern world we can do more around the experience of individuals at scale, and I think digital offers much more opportunity to really understand the continuous experience of individuals. What I'm reflecting on and we're thinking about kind of as we think about what we would need to do going forward is how do you have that autonomous and kind of independent view and holding the mirror up, which I think was really important function of Healthwatch.
The director of West Suffach Alliance says access to emergency dental treatment is increasing across SNE, with thousands of additional appointments for those in urgent need. He spoke about the ICB's dental vision to improve access to dental care, to improve oral health and to increase the skill of the system's workforce. The Deputy Director of Commissioning for Pharmacy, Optometry, Dentistry and Vaccination at the ICB, Nicola Brunning, told the board about the progress that has been made across SNE.
432,778 people have been seen, which is just under 44% of the population. There's a trend here across those 5 years of increasing access to care. It's fair to say that access to care for children has recovered much faster than it has for adults. There are some reasons for that, which I'll go into in a minute, but it's just an example that around 10,000 more people in our area have been able to access care in the last year.
Peter Whiteitman spoke about the Dental Priority Access and Stabilisation Service pilot, which aims to improve access to dental services for the most vulnerable and in need populations in SNE. 18 primary care dental practices are participating in the pilot. Peter also said in February this year the ICB was asked to commission an additional 15,000 urgent care appointments in 25-26. He said this brought the total number of such appointments commissioned for the current financial year to around 60,000. The Suffolk Safeguarding Partnership's annual report was shared with board members. The report outlines what has been achieved over the past 12 months and looks forward to priorities for the next year. To access the report, please visit the Board Papers section on the SNE ICB website. The board received an update on the system's performance across SNE. Here's Richard Watson.
On urgent emergency care, we're just slightly behind plan on the latest data on some of the main metrics, particularly the 4-hour. We've got particular work we're doing with Nick and Nick's team around the Ipswich Hospital site. There was a meeting actually last week, which was really good. Thank you for the invite to the team, which was looking at what's the challenges around hitting the 4-hour performance and a really clear plan, I think, around how that can now be achieved, hopefully sustainably. So particularly within UEC, we've got the focus with ESNEFT around the 4-hour performance, while continuing to ensure that we are delivering the other metrics. In terms of elective, I think it's fair to say the concern that we've got relates to West Suffolk in terms of our elective and diagnostic performance against plan as it stands. West Suffolk are currently in tiering, which effectively is an NHS England process with Tier 1 and Tier 2. So as West Suffolk is in Tier 2, which effectively means regional involvement, active involvement with the ICB on looking at performance through a fortnightly meeting. The Trust is in the process of finalising a recovery plan, which we're due to get, I think, tomorrow for the tiering meeting. So that will be the focus of that meeting tomorrow. So we might want to talk a little bit about that in a second. And then on cancer, we were doing relatively well. We've dipped at both hospitals at the latest data. That's starting to improve, but the particular challenge at ESNEFT, and Nick might comment later, is on lower GI. We were doing well, it's dipped a little bit again, but we are back on it, and actually the Cancer Committee is meeting as we're meeting to focus on some of the performance challenges. And at West Suffolk, we had a significant dip around breast performance. We've agreed through Nicola Coddington, who's the lead within the Trust, and myself, that we're inviting a national team to come in and support the Trust and ourselves on really understanding what some of the causal factors around the breast performance challenges that we've had on and off for a couple of years now, and really looking at how we can again make that more sustainable.
Richard also reported that the system has achieved 6 of the 8 national standards for mental health provision. The Director of Finance, Howard Martin, gave an update on the finances.
The ICS position continues to be on track for month 3, which is very positive, but just to note the current risks to forecast delivery being the required improvements in run rate at both West Suffolk and ESNEFT from Q3 onwards, and that significant potential redundancy costs for which at the moment there is no indication of any national support, and we have not made any provision. Again, we're not alone in this regard. All ICBs are in the same position.
The board also received an update from the ICP Director, Susanna Howard. She spoke about the system's Can Do Staff Awards that took place earlier this month.
We had 93 finalists. They represented all parts of the NHS, all 5 of our NHS provider trusts, the ICB obviously, local authorities, all parts of primary care. So it was really great to see some pharmacists shortlisted there, general practice, and of course our voluntary community sector as well.
The board was then asked to approve an amendment to the Constitution to allow 3 board members whose terms are due to expire in 3 months' time to be extended. It's in light of the proposed changes to the ICB's configuration, and that any appointments made in July 2025 may only run until April 2026. The board agreed to extend their terms. And members were also asked to approve the Board Assurance Framework for May 2025. The framework, known as BAF, focuses on risks that, if realised, would prevent the ICB from achieving its strategic objectives as set out in the Joint Forward Plan. Well, the next board meeting will be taking place on Tuesday the 23rd of September at Thurston, starting at 9 a.m. And for more information and to look back at the recording of the board, please visit the events page on the ICB website.